I want you to understand something very important. If you wake up every morning with a dry mouth, this is not just a minor inconvenience. Your body is sending you a signal that something needs your attention, and ignoring it could lead to serious consequences. This video is for information purposes only. It is not medical advice. For any health concerns, please consult a qualified doctor. Let me explain what is really happening when you wake up with that uncomfortable dry sensation in your mouth. As a doctor, I see patients who dismiss this symptom every single day, not realizing what their body is trying to communicate. Your mouth produces saliva constantly throughout the day and night. This is not just for digestion. Saliva protects your teeth, prevents infections, helps you swallow, and maintains the delicate balance of bacteria in your oral cavity. When you wake up with a dry mouth, medically termed xerostomia, your saliva production has significantly decreased during sleep. This decrease is your body's warning system activating. The most common reason people experience this is mouth breathing during sleep. When you breathe through your mouth instead of your nose, the airflow directly dries out the moisture in your oral cavity. But why would you breathe through your mouth while sleeping? There are several medical explanations. Nasal congestion from allergies, a deviated septum, or chronic sinusitis forces air through your mouth instead of your nasal passages. Sleep apnea is another critical factor that many people overlook. This condition causes repeated pauses in breathing during sleep, and your body compensates by opening your mouth to get more air. This is a serious disorder that affects your heart, brain, and overall health. Medications are responsible for dry mouth in millions of people worldwide. Antihistamines, antidepressants, blood pressure medications, and many other common drugs list dry mouth as a side effect because they reduce saliva production. If you take multiple medications, the drying effect compounds. Your salivary glands respond to these chemicals by producing less moisture, leaving you with that parched feeling every morning. Dehydration is often underestimated as a cause. If you do not drink enough water throughout the day, your body prioritizes vital organs and reduces saliva production during sleep when you are not actively drinking. Diabetes can manifest with chronic dry mouth as one of its early warning signs. High blood sugar levels affect your kidneys, causing increased urination, which leads to dehydration and reduced saliva. Your salivary glands themselves can become damaged or dysfunctional. Autoimmune conditions like Sjogren's syndrome specifically attack these glands, dramatically reducing their ability to produce moisture. Radiation therapy for head and neck cancers can permanently damage salivary glands. Patients who have undergone such treatment often struggle with chronic dry mouth for years afterward. Aging naturally reduces saliva production to some degree. However, if you are experiencing severe dryness, age alone is not the explanation. There is usually an underlying condition contributing to the problem. Hormonal changes, particularly in women going through menopause, can affect moisture levels throughout the body, including saliva production. The decrease in estrogen impacts multiple systems simultaneously. Nerve damage from injuries or surgeries in the head and neck region can disrupt the signals that tell your salivary glands to produce moisture. This type of damage may be temporary or permanent depending on severity. Smoking and tobacco use severely impair saliva production. The chemicals in tobacco irritate the delicate tissues of your mouth and reduce the efficiency of your salivary glands over time. When you consistently wake up with a dry mouth, you are not just dealing with discomfort. You are facing real health consequences that develop gradually but persistently. Your teeth become vulnerable to decay because saliva neutralizes acids produced by bacteria. Without adequate saliva washing over your teeth at night, cavities form much more easily. Gum disease develops faster in a dry mouth environment. Saliva contains antibacterial compounds that keep harmful bacteria populations under control. When this protection disappears, your gums become inflamed and infected. Bad breath becomes a chronic problem because bacteria thrive in a dry environment. The compounds these bacteria produce create strong, unpleasant odors that brushing alone cannot eliminate. Fungal infections, particularly oral thrush caused by Candida, flourish when your mouth lacks protective saliva. You may notice white patches on your tongue or inner cheeks. Difficulty swallowing and speaking clearly can develop because saliva lubricates these processes. Without it, your tongue sticks to the roof of your mouth and food becomes harder to swallow safely. Your sense of taste may diminish because taste buds require moisture to function properly. Saliva dissolves food particles and carries them to taste receptors, and without adequate saliva, flavors become muted. Mouth sores and cracked lips appear more frequently in people with chronic dry mouth. The protective barrier that saliva provides is missing, leaving tissues vulnerable to damage and slow healing. Your risk of developing serious dental problems multiplies over time. I have seen patients lose multiple teeth unnecessarily because they did not address the underlying cause of their dry mouth. So, what should you do if you wake up with a dry mouth regularly? The first step is identifying the cause, which requires honest evaluation of your symptoms and lifestyle. Pay attention to whether you snore loudly or wake up gasping for air. These are red flags for sleep apnea that require immediate medical evaluation with a sleep study. Check if you breathe through your nose easily during the day. If you struggle, you may have structural issues or chronic congestion that needs treatment from an ear, nose, and throat specialist. Review all your medications with your doctor. Sometimes dosage adjustments or switching to alternative medications can reduce dry mouth while still treating your underlying conditions effectively. Evaluate your daily water intake honestly. Most people significantly underestimate how much water they actually drink. You need consistent hydration throughout the day, not just large amounts at once. Consider your sleeping environment. A humidifier in your bedroom adds moisture to the air, which can help prevent your mouth and nasal passages from drying out overnight. If you have diabetes risk factors like family history, excess weight, or sedentary lifestyle, get your blood sugar tested. Early detection and management prevent countless complications. Women experiencing menopausal symptoms should discuss dry mouth with their healthcare provider. Hormone therapy or other interventions might address multiple symptoms simultaneously. For those who smoke, quitting is not optional if you want to resolve dry mouth and protect your overall health. The damage tobacco causes extends far beyond your mouth. There are practical strategies you can implement tonight to reduce morning dry mouth. Keep water by your bedside and take small sips if you wake during the night. Use a fluoride toothpaste and consider a moisturizing mouth rinse specifically designed for dry mouth before bed. These products provide temporary relief and protection. Avoid caffeine and sugary drinks in the evening. Both can worsen dehydration and create conditions that reduce saliva production during sleep. Breathing exercises and nasal strips can help train yourself to breathe through your nose. This takes conscious effort initially, but becomes natural with practice. Chewing sugar-free gum during the day stimulates saliva production. Xylitol-containing gum also helps reduce cavity-causing bacteria in your mouth. Some people benefit from saliva substitutes or stimulants prescribed by their doctor. These medications or products directly address the moisture deficit when natural production is insufficient. If autoimmune disease is suspected, specific blood tests can confirm conditions like Sjogren's syndrome. Early treatment helps preserve remaining gland function and manage symptoms. Regular dental checkups become even more critical when you have chronic dry mouth. Your dentist can monitor for early signs of decay and gum disease, intervening before problems become severe. Do not ignore persistent dry mouth, hoping it will resolve on its own. The underlying causes rarely disappear without intervention, and the consequences accumulate silently. Your mouth is giving you valuable information about your overall health status. Dry mouth can be the first noticeable symptom of diabetes, sleep disorders, or autoimmune disease. The quality of your sleep affects every aspect of your health. If mouth breathing or sleep apnea is causing your dry mouth, treating these conditions improves your energy, mood, cardiovascular health, and cognitive function. I have seen patients transform their health by taking dry mouth seriously. One simple symptom led them to discover and treat conditions they did not know they had. The connection between oral health and systemic health is profound. Bacteria from gum disease can enter your bloodstream and contribute to heart disease, stroke, and other serious conditions. Your saliva contains growth factors and proteins that promote healing throughout your digestive tract. Adequate saliva production supports your entire gastrointestinal system, not just your mouth. When you address dry mouth, you are not just making mornings more comfortable. You are protecting your teeth, preventing infections, and potentially uncovering serious health issues early. Many people feel embarrassed discussing dry mouth with their doctor, viewing it as trivial compared to other symptoms. This mindset prevents early diagnosis of treatable conditions. Medical professionals understand that every symptom provides clues to your overall health picture. Dry mouth deserves the same attention as chest pain, fatigue, or any other physical complaint. The financial cost of ignoring dry mouth adds up quickly. Dental treatments for cavities, root canals, and tooth replacement are expensive and often preventable. More importantly, the health costs are immeasurable. Undiagnosed sleep apnea increases your risk of heart attack and stroke. Untreated diabetes leads to kidney failure, blindness, and amputations. Your body communicates constantly through physical sensations and symptoms. Learning to listen and respond appropriately is one of the most important health skills you can develop. Dry mouth is your body speaking clearly. It is telling you that something in your sleep pattern, hydration status, medication regimen, or underlying health needs attention. The solution starts with awareness and acknowledgement. Recognize that this symptom matters and deserves investigation rather than dismissal. Schedule an appointment with your primary care doctor specifically to discuss your dry mouth. Bring a list of all medications, supplements, and any other symptoms you have noticed. Be prepared to answer questions about your sleep quality, snoring, breathing difficulties, water intake, and medical history. Complete honesty helps your doctor identify the cause quickly. If your doctor recommends a sleep study, take it seriously. Sleep apnea is incredibly common but often undiagnosed, and treatment can be life-changing. Follow through with any referrals to specialists. Ear, nose, and throat doctors, dentists, and endocrinologists each bring expertise that addresses different aspects of dry mouth causes. Implement lifestyle changes your doctor recommends consistently. Improvements in hydration, sleep position, and environmental factors require sustained effort to show results. Track your symptoms in a journal. Note how often you wake with dry mouth, what you ate or drank the evening before, and any other patterns you observe. This information helps your healthcare team refine their diagnosis and treatment plan. Objective data is more valuable than vague recollections during appointments. Be patient with the diagnostic process. Finding the exact cause sometimes requires ruling out multiple possibilities through tests and trials. Once the cause is identified, commit fully to the treatment plan. Whether it is using a CPAP machine for sleep apnea, adjusting medications, or managing an autoimmune condition, consistency determines success. Your oral health routine must intensify when you have dry mouth. Brush at least twice daily with fluoride toothpaste, floss daily, and use antibacterial or moisturizing rinses as recommended. Consider investing in an electric toothbrush and water flosser. These tools clean more effectively than manual methods, which is crucial when your natural defenses are compromised. Replace your toothbrush every 3 months or sooner if bristles fray. Bacteria accumulate on old brushes and reintroduce them to your mouth. Avoid alcohol-based mouthwashes as they further dry your mouth. Look for products specifically formulated for xerostomia that provide moisture and protection. Limit acidic foods and drinks, especially before bed. Citrus, tomatoes, and soda weaken enamel, and without saliva to neutralize the acid, damage accelerates. Increase your intake of water-rich foods like cucumbers, watermelon, and celery. These help maintain hydration throughout the day. Green tea and herbal teas without caffeine provide hydration while offering additional health benefits. Just avoid adding sugar. Monitor your protein intake, as adequate protein supports tissue repair, including your oral tissues. Lean meats, fish, beans, and dairy provide essential building blocks. Vitamin deficiencies, particularly B vitamins and iron, can contribute to dry mouth and oral health problems. A balanced diet or appropriate supplementation addresses these gaps. Some patients find relief using over-the-counter saliva substitutes available as sprays, gels, or lozenges. These provide temporary moisture when natural production is low. Prescription medications that stimulate saliva production exist for severe cases. Pilocarpine and cevimeline are options your doctor might consider if other approaches fail. The goal is not just symptom relief, but addressing root causes. Temporary fixes help you cope while working toward lasting solutions. Remember that dry mouth often signals multiple contributing factors working together. Successful treatment usually requires a comprehensive approach addressing several areas simultaneously. Your commitment to solving this problem directly impacts your long-term health outcomes. The effort you invest now prevents serious complications later. Share what you learn with family members, especially if conditions like sleep apnea or diabetes run in your family. Your experience might prompt them to address their own symptoms. Educate yourself about the specific condition causing your dry mouth. Understanding the mechanism helps you make informed decisions and advocate for your health. Join support groups if you are dealing with chronic conditions like Sjogren's syndrome. Connecting with others facing similar challenges provides practical tips and emotional support. Technology offers helpful tools. Apps can remind you to drink water, track symptoms, and even monitor sleep patterns that might reveal breathing issues. Some smart devices detect snoring and sleep disturbances, providing data you can share with your doctor to support a sleep apnea diagnosis. Do not let embarrassment about wearing a CPAP mask or taking medication prevent you from getting treatment. Your health and quality of life matter more than appearance or convenience. Many people report that once they adapt to treatments like CPAP therapy, they wonder why they waited so long. The improvement in energy and well-being is dramatic. Your body wants to heal and function optimally. When you remove obstacles and provide what it needs, remarkable recovery happens. Dry mouth is reversible in many cases once the underlying cause is treated. Even when complete reversal is not possible, management strategies exist. The difference between thriving and merely surviving often comes down to addressing symptoms you might consider minor. Dry mouth falls into this category. Your morning routine should leave you feeling refreshed and ready for the day. Waking up uncomfortable with a parched mouth is not normal or acceptable. You deserve to understand what your body is communicating and to receive appropriate care. Do not settle for less than answers and solutions. Medical science has advanced tremendously in understanding and treating dry mouth and its causes. Options exist that were not available even a decade ago. Your healthcare team wants to help you feel better. They cannot do that if you do not bring symptoms to their attention or follow through with recommendations. Taking action today prevents regret tomorrow. The patients I see with the most serious complications are often those who ignored early warning signs. Your mouth is the gateway to your body. Protecting it protects your entire system from infection, inflammation, and disease. Saliva is one of your body's unsung heroes, working constantly to defend and maintain your health. Supporting its production is supporting yourself. Every night you go to sleep is an opportunity for your body to repair and restore. Dry mouth interferes with this process in ways you might not consciously notice. Quality sleep requires breathing properly, staying hydrated, and maintaining healthy tissues. Addressing dry mouth improves all these factors. You have more control over your health than you might realize. Simple changes in habits, environment, and healthcare engagement create significant improvements. The knowledge you gain from investigating your dry mouth empowers you in all areas of health. You become more attuned to your body's signals. Prevention is always easier and less expensive than treatment. Protecting your teeth and gums from the damage dry mouth causes saves you from painful and costly procedures. Your smile affects your confidence, social interactions, and professional opportunities. Maintaining oral health is an investment in your quality of life. Children and young adults who develop dry mouth need especially careful evaluation. Early onset often indicates conditions requiring prompt treatment to prevent lifelong complications. Pregnant women experiencing dry mouth should discuss it with their obstetrician. Hormonal changes are common, but some causes require monitoring for mother and baby's health. Athletes and people who exercise intensely need to be particularly vigilant about hydration. Intense training increases fluid requirements significantly. People working in dry environments or outdoors in hot weather face additional challenges. Occupational factors contribute to dehydration and must be counteracted intentionally. Night shift workers often struggle with hydration and sleep quality. The disruption to natural rhythms affects multiple body systems, including saliva production. Anyone taking new medications should ask their pharmacist about dry mouth as a side effect. Being informed helps you watch for symptoms and address them early. The pharmaceutical industry continues developing better treatments with fewer side effects. If your medication causes unbearable dry mouth, alternatives might exist. Complementary approaches like acupuncture show promise for some people with dry mouth, particularly when conventional treatments have limited success. Discuss these options with your doctor. Your mental health connects to your physical symptoms. Anxiety and depression can worsen dry mouth, and chronic physical discomfort affects your emotional well-being. Addressing the whole person, not just isolated symptoms, leads to the best outcomes. Mind and body are inseparable in health and disease. You are not alone in experiencing dry mouth. Millions of people worldwide deal with this issue daily. Resources and support are available. The internet provides valuable information, but verify sources carefully. Medical misinformation spreads easily. Trust established medical institutions and peer-reviewed research. Your doctor is your best resource for personalized advice. Generic information provides context, but your unique situation requires individual assessment. Building a trusting relationship with your healthcare providers improves care quality. Open communication ensures nothing important gets overlooked. Regular checkups catch problems early when they are easiest to treat. Skipping appointments because you feel fine means missing opportunities for prevention. Your health is your most valuable asset. Protecting it requires ongoing attention and investment. Dry mouth is one signal in an ongoing conversation with your body. Listen carefully to what your body tells you through symptoms. Respond thoughtfully with appropriate action. This cycle of awareness and response keeps you healthy. The path from symptom to solution is not always straightforward. Persistence and patience are essential. Keep working with your healthcare team until you find answers. Celebrate improvements, even small ones. Progress happens gradually, and acknowledging it keeps you motivated. Your efforts to understand and address dry mouth demonstrate self-respect and responsibility. These qualities serve you well in every aspect of life. The information I have shared today comes from years of medical training and clinical experience helping patients just like you. It is meant to empower, not frighten. Knowledge removes uncertainty and replaces it with action steps. You now know what dry mouth might indicate and what to do about it. Tomorrow morning, pay attention to how you feel when you wake up. If your mouth is dry, commit to finding out why and doing something about it. Your future self will thank you for taking action today. The health you preserve now supports you for decades to come. So if you like this video, please like and subscribe for more videos like this.